I love to talk about testosterone because there are so many myths and controversies regarding testosterone. So many people think that it's related to roid rage or steroid rage, or that it increases your risk of getting prostate cancer, or it increases your risk of getting a heart attack. And these are all myths that have really been shown to be false and actually debunked by Dr. Abraham Morgentaler from Harvard. As we age, we know our hormones decline, and testosterone is one of those major hormones that decline. What's really interesting is that it's a very powerful hormone for males, but it's also very powerful for females as well. And not only is it used in the sense that it improves our energy or cuts fat or makes you a little bit more muscular if you're working out and exercising, but it's really a very powerful hormone on the brain, and we call that a neurosteroid. The biggest myth that I see again with testosterone is the fact that people believe that maybe it increases prostate cancer, and studies have actually shown that when your testosterone is on the lower side, you have actually a higher risk of getting prostate cancer. And if you do get prostate cancer, it's been shown to be actually a more aggressive form of prostate cancer. Studies have also shown that patients who have lower testosterone have actually a higher risk of having a heart attack or stroke. Another myth that I see often associated with testosterone, which kind of, always irritates me in the sense that patients say, well, I looked at my blood and my red blood cells and my hemoglobin and hematocrit, which is a way that we look at your blood, the thickness of your blood is high. I need to go get a blood donation. I need to donate blood. Again, that's another myth that has never been shown to be true. Just because your hemoglobin or hematocrit or red blood cells are a little bit higher does not necessarily mean that you're having a risk of having a blood clot or a stroke. Actually, never in the literature has that shown to happen, but people believe that because they're told from somebody else that my blood is thicker. Now, testosterone increases your red blood cells. Yes, it does, and that's a physiologic or normal response. We call that erythrocytosis. It's not pathologic, it's physiologic. Similarly, if you have a lung disease known as chronic obstructive pulmonary disease, or you live at high altitude, you're going to have thicker red blood cells, higher hemoglobin. Nobody's going to tell you to go donate blood. That's just normal. That's actually what gives you the energy, the oxygenation of your blood, that the fact that you have more red blood cells and higher hemoglobin. So that's another myth that is definitely wrong. Lastly, estrogen. Estrogen is another myth that patients think that just because the testosterone increases their estrogen, they need an estrogen blocker. And if you really want to feel crappy, what I say, go ahead and lower your estrogen levels, males, and you're going to feel really crappy. Estrogen is an important hormone for females as well as males, and when your estrogen is at a nice therapeutic level, you're actually going to lose fat, burn fat, improve cognition, focus, and libido. And that's actually what medical studies have shown. One of the most important things about what I do, and I have a lot of training in this field. I'm actually a board-certified anti-aging medical doctor. So I've taken the highest qualifications in this field, meaning that I've taken both an oral examination and a written examination. So I'm held to a higher standard in it. And I'm board-certified in anti-aging medicine, functional medicine, as well as regenerative medicine, meaning stem cells and PRP. So we really do it all, and we focus on evidence-based medicine.